Docs used to be in their own small private practices, and now they generally work for health systems. And, I got a lot of good friends that are primary care docs, but their schedules are very regimented, 20 minutes like this. Again, it's a disease management system.
Hi, everybody. This is Diane Gilman, formerly known as the Queen of Genes on QVC-HSM, but now the proud host of my podcast, Too Young to Be Old. And we have got an incredible guest today, a total expert at your metabolic health. And what does that mean? Well, if you watch cable TV the way I do as an oldster, and you see constantly, if you can't lose weight around the middle, hello, that's me. You have got insulin resistance. Yikes! What is that? Guess what? We're going to get it explained to us today, and possibly a solution for actually seeing a waistline again. So, Dr. Paul Kolodzik, welcome, welcome, welcome.
Thank you very much for having me, Diane.
Oh, it's such a pleasure. Tell me, why did you choose metabolic health to be your focus as a doctor?
So my background actually is in emergency medicine. I spent 25 years in the emergency department, and a lot of that time was spent seeing preventable problems. People coming in with complications of obesity, coming in with complications of diabetes, complications of insulin resistance, which also relates to high blood sugar. So seeing the heart attacks and the strokes and the peripheral vascular disease and the diabetics with kidney failure and sight issues, retinal issues. So about 7 years ago, I decided to be proactive instead of reactive in the emergency department and started my metabolic health and weight loss practice.
And you know something? It is there's such a difference. I travel a lot and have in the past for business to Europe, to Asia. Other countries don't have this problem. So where do you think the problem with obesity in America comes from?
Well, if you think about it, if you look back at photographs or movies from the 1960s or before,
Yes.
you, you don't see that level of obesity. So I'm going to try and not focus too much on a conspiracy theory, but this is my belief that the food pyramid came out early in the 1970s, and overnight, I'm a low carb person. Overnight, we changed our diet from 50% fat to 25% fat, but we also changed our diet from 25% fat to 50% carbohydrates.
Yeah.
And I believe that spawned the epidemics, first of obesity and then of diabetes.
I first had a problem, and I was always on a diet yo-yo, but never exaggerated until I became a widow at the age of 52, which of course clashed, boom, with menopause and your body's changing. And I didn't know it, but I became a carbogenarian. I went home every night. The house was empty and silent, turned on the TV, boiled water, threw in a pound of pasta, threw on a can of tomato sauce that obviously had tons of sugar in it as well.
Yeah.
And was completely uneducated to the fact that the minute you have carbohydrates hit saliva in your mouth, it turns into sugar. And then I would be very restless sleep because obviously sugar levels were high, and I'd be exhausted the next day. And what would I do to cut some of the exhaustion? Eat one of the energy bars that was all sugar. If you are not highly educated in America, you have no idea what you're setting yourself up for. And I do want to get to one thing that I so agree with you on, which is the American medical system. It's not about disease reversal or prevention. It's just about maintenance. And you really see that when you're someone like me in a big city like New York and you're going to your hospital and it is so minimal and they feel really put out if they have to actually explain anything to you that they're doing to you.
Yeah, we have a disease management system as our medical system. So we don't focus on prevention or reversal. You think about it, you go to your doctor a couple times a year, routine primary care visit, and, the doc's got his face in the computer typing away to meet all the documentation criteria. And you're maybe a little bit overweight or have a little bit of problems with your blood sugar, and the answer is, yeah, your blood sugar is a little bit high. We'll keep an eye on that for a while because they're waiting until you turn diabetic before they can actually manage it. Or if your weight's a little bit high, it's just, oh, you know what? Eat less and exercise more. You don't get more direction than that. And that's really why I went into independent practice, because you can prevent and reverse disease with some focused lifestyle changes that I'm sure we're going to have the opportunity to talk about here.
Absolutely. So the first one to me is I see it on the television all the time. It terrifies me. Insulin resistance. I'm sure I must have it, but I really cut down on my carbs and I'm not that attracted to sugar. And
Good.
nobody, when they do my blood work, ever says, "Oh my God, Diane, your sugar count is so high. Here's what you need to do." Nobody even says my sugar count is so high. And yet, I am the perfect image of an insulin resistant, middle aged body. How did I get this? How did we all get this? And what can we do about it?
So, just a simple explanation of what insulin resistance is. When you eat a carbohydrate, as you mentioned, it immediately becomes sugar in your system. And you need some blood sugar in your system. At the time you eat that carbohydrate, as soon as, potato, bread, rice, pasta, it becomes blood sugar in your system immediately. So your blood sugar goes up, your pancreas releases insulin, and that insulin is the key and the lock to let that blood glucose into your organs. And when I say organs, let's think muscles. And so that blood glucose then gets absorbed. So far, so good. But if your blood glucose is persistently high because of this high carbohydrate diet that we talked about for a period of time, then after a while, those organs that already have enough energy, enough stored blood glucose, say, insulin, we aren't going to listen to you anymore. That's what insulin resistance is. It's the organ saying they won't listen to insulin anymore. And so what happens with that extra blood glucose in your system? Well, something has to happen to it because it's toxic. So it goes to the liver and it gets converted to fat and deposited around the middle.
God.
Yeah, and for people that have fatty liver disease, some of that that blood glucose getting converted to fat stays in the liver, but a lot of it gets deposited around the middle, and from then on, it becomes very difficult to lose weight until you reverse your insulin resistance.
So I thought I really had cut down on it, but yet when I think about it, my diet today is going to be leftover pasta with meatballs from yesterday, which I'm sure made with a lot of breadcrumbs. So there it is. And this morning, and every morning, I have one slice of bread, and I try to make it gluten free, because that's what I'm focusing on. But now that we're talking about it, I've had carbs for breakfast. I'm about to have almost 100% carbs for lunch. Wow. So, where do I need to go? How do we, as a society, change our diet in a realistic way? Because most people, obviously, including me, are not very educated about glucose and definitely not great at self discipline when it comes to diet. What are your suggestions?
Well, first of all, you aren't alone because all the forces are in the direction of pushing us toward processed food. And processed foods are basically consist of sugar, refined carbohydrates, and usually inflammatory seed oils.
Yeah.
So all the forces, and you can have a food that has maybe a low cholesterol count, a fat count, and it's advertised as being healthy, but it can be just packed with carbohydrates. So all the forces are in that direction. But the first thing to do is to do what you're doing, which is educate yourself. Educate yourself about your carbohydrate intake. And you asked about a test that can be helpful related to insulin resistance in this whole issue. And that test is a fasting insulin test. I think fasting insulin tests should be as common as cholesterol tests in this country, but they're rare. I very rarely have a patient come to me that's already had a fasting insulin test. So one thing I hope that your listeners take away is if they're concerned about insulin resistance, or they're overweight, or they're pre-diabetic, or they have diabetes in their family, to ask their doctor for a fasting insulin test.
Now, I do, because I'm so focused on losing weight around the middle, which never happens, but the rest of me, I mean, my legs can't get any skinnier. They're already like toothpicks on a meatball. For me, I will tell you, going to a GP, even in a big, sophisticated city like Manhattan, nobody ever said that to me.
Right.
They
Yeah.
may, you've got to lose some weight, look at your middle, but they never, not one of the doctors took any kind of glucose test and read it off to me, ever said, here's how I want you to eat. So for me, and because I've got an older body, I'm almost 80, I don't want a lot of food weighing me down. Therefore, I tried intermittent fasting, which really worked
Great.
for me. Is that good for someone who's got insulin resistance?
Yes, absolutely. It's great. The best ways to lower insulin resistance are twofold, actually threefold. We'll get into the third one. But it's a low carb diet and intermittent fasting. And I need to say, related to the assessment, fasting insulin level was important, but the other thing that anybody can do now is get a continuous glucose monitor. And I know we're going to get into this, but a continuous glucose monitor is those devices that you see on the back of the arms of diabetics that diabetics have used for years to dose their insulin. But for the last 7 years in my metabolic health practice, I've been using them in non-diabetics and pre-diabetics, because you can see what your blood glucose is 24/7. And these devices are great to use diagnostically to understand where you are to start with, and then great to use therapeutically to help guide your low carb diet.
So, is what you're saying that for someone like myself, or a zillion post, pre, and in the middle of the change of life women, for us who are dealing with menopause, and once you go through menopause, you're dealing with it for the rest of your life, that we should be insulin and glucose aware. And I have absolutely no diabetes in my family, and never any discussion of it. But what I think happens in Western medicine, and I'm on Medicare, if you as a medical institution are not going to get paid back for a test you suggest, you don't suggest it.
Yeah, unfortunately, the incentives in medicine are that way. The difference I've seen in my lifetime with medicine is, docs used to be in their own small private practices, and now they generally work for health systems. And, I got a lot of good friends that are primary care docs, but their schedules are very regimented, 20 minutes like this. It used to be a little bit different. So now, again, it's a disease management system. And so the focus of the health systems are what drives the dollars, unfortunately, is the big procedures, the cardiac bypasses, the hip replacements, those types of things. Prevention and reversal of disease doesn't get a lot of attention. And so that's why people have to empower themselves and take it upon themselves to understand, for example, what the American diet does to them, and educate yourself about low carb intermittent fasting. And the third component is strength training, so that you can reverse those issues.
The real truth to me is, and I see it from a very vanity driven point of view, we're just going to get to GLPs like Ozempic. I live in a fashionista world, right? And those are my acquaintances. Those were my workmates. So vanity rules. I do not know, doctor, one person that got Ozempic for a good reason. It was, oh, I'm going to the Caribbean in 3 weeks. I feel a little flabby. Oh, take Ozempic. Oh my God, I've got a wedding in 2 weeks. I've got to fit into the dress. Oh, take Ozempic. All I know are people who were not that overweight, to tell you the truth, that were given Ozempic by a GP, not someone who was focused in on them for diabetes or any kind of sugar related illness or pre-illness, and they took it for vanity reasons for a few weeks. And meanwhile, am I wrong in thinking there's actually a huge waiting list for Ozempic from people who have diabetes, who are morbidly obese, and who really need the drug?
Yeah, the medications are definitely in short supply, and there are criteria for use of the medicine. And for example, in my practice, I do use the medications limitedly, but only in association with lifestyle changes, low carb, intermittent fasting, strength training, continuous glucose monitored diet. So I think the medicines can be good medicines and have their place, but the criteria is that you're supposed to have a BMI, body mass index, greater than 30, or a body mass index greater than 27 with some kind of metabolic health issue, hypertension or prediabetes or whatever, should not be prescribed otherwise.
Wow. And, I was just discussing with you on the fashion end of it that Kate Moss's sister recently was rushed to the hospital in London and had to stay for like 3 or 4 days for overdosing on Ozempic, for feeling like she wanted to be the thinnest she could be. She was sure that if she just took triple the amount she was dosed out for, that she was going to get to the BMI she wanted, which was probably 1 or 2. I mean, the woman is really, to me, lean to begin with, but everybody's got their own body dysmorphia. And she said that she had overwhelming nausea and vertigo. That's pretty scary. How do you get those symptoms?
Well, I think these medicines, when used, first of all, they should be used in a minority of people and only after the lifestyle changes we've discussed are in place. And then, of course, some providers and some pharmaceutical companies want people to get on these medicines and be dependent on them for life. So the way they should be used is only in people that meet the criteria for them. And I believe they should be used in very low doses for very limited periods of time, if used at all, to get a little jump start or to work through a plateau in somebody that really does have a weight issue, but then titrated down and have patients get off the medicine, which they're able to do if they've made the lifestyle changes that we've talked about.
Yeah, the people that I know that have used it just dipped in, just went to their GP and said, I've got to lose 12 pounds to get into this little black dress. Help. And no one ever in the medical community said no to them. They all said, sure, here, take it. Now, here I am with this chubby middle and these tiny little arms and legs. And I want to lose that weight around the middle. And I'm sure there are a million middle-aged women out there, and I hope they're all listening, who are saying, oh, me too, Diane, Dr. Kolodzik, what do I do? So if you were going to give a generalized diet to someone like me who has tried and tried, but obviously look what's in my refrigerator. I mean, it's all wrong. What would you say?
So I think first you need a complete diagnostic assessment, which would include using a continuous glucose monitor for a couple of weeks to see what your blood glucose patterns look like, and then also a fasting insulin level to calculate your level of insulin resistance. And that's what I do with my patients. And then we put them on a program, usually guided by a continuous glucose monitor, which is a low carb diet, usually under 50 grams a day, high protein, intermittent fasting, and strength training is huge too, especially important in older women because your muscle mass relates to your degree of osteoporosis. Strength training, I think, is, we focused on getting on the ellipticals and getting on the treadmills for 50 years, when really strength training, I think, is much more critical. And if you can increase your muscle mass, you are increasing the quality and the receptivity of the insulin receptors on your muscles as well. So you're soaking up more blood glucose, you're soaking up more insulin, and you're helping to reverse that insulin resistance. So in a nutshell, it's low carb, guided by a continuous glucose monitor, intermittent fasting, and strength training.
Now, when I think about what I'm attracted to in terms of what I want to eat, and I make a horrible mistake of, we have a great delivery system in Manhattan for food. So late at night, and I'm usually feeling hungry, but I live in a duplex, so I'm too lazy to go downstairs, thank God, where the refrigerator is. So I just stay hungry. Never shop for food when you're hungry.
Yeah.
I'm like, pasta, yum, 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 yum. Creamy stuff like sour cream, cream cheese, and a bagel. Another big issue of eating breads. Yum, 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 yum. Is my attraction to carbohydrates and creamy foods indicative of insulin resistance and my body shape, or that's just me?
No, it is indicative of that. And, we've been trained that way, again, by the food processing industry, who have food scientists that make foods addictive in that way. But it can be reversed. It takes persistence, it takes time and effort, it takes people educating themselves. That's one reason I love continuous glucose monitors so much, because the way my patients put it is, once they see those curves, those spikes in blood glucose on their CGM, they can't unsee it. And so the last chapter in the book is continuous glucose monitors change lives. And they really do, because once you see that data, you modify your lifestyle, and it can be very, very helpful moving forward as you age.
I think my big question is, if somebody is listening and they say, you know what, I've got all the symptoms Diane has, and I'm so sick of trying to diet and never getting a change in my body shape, how do we find a doctor in our area who's a metabolic specialist? I mean, I really and truly, and believe me, my podcasts are all what I call infotainment. They're educational and they're entertaining and really fascinating, hopefully at the same time. How do I find a doctor who can do what you do? I've never even heard of that before. Where do I go? I mean, if I called up my hospital system, I don't, which is Mount Sinai in New York, and is huge and aggressively growing all the time, good thing or not. Well, I'm going to say to a phone operator, oh, I need a metabolic doctor. They'd be like, what?
Yeah, yeah, we're a new breed, that's for certain, and
Oh,
we're a bit anti-establishment, again,
I
because
like.
we're all about disease reversal and prevention. I will tell your listeners that there is an organization that I was a founding member of called the Society of Metabolic Health Practitioners, SMHP, the Society of Metabolic Health Practitioners, that has a provider directory listed there. So I would send you to that site.
Now, interestingly enough, I went through breast cancer, was diagnosed Christmas Eve 2017, 2018 and 19. Went through chemotherapy, which really knocked my whole system out, right? But it did the job. Went through radiation, went through surgery, a double mastectomy, what impressed me, and it was great, great, great medical treatment for me. When you walk into the Great Hall at Mount Sinai on Fifth Avenue in New York, there are the 12 commandments of diet and lifestyle. Do not smoke cigarettes. Do not drink alcohol, which I learned turns into sugar, especially in hard alcohol, wine. Okay. Do not eat red meat. I get that. Goes on, but never once says, watch your carbohydrates. Because the one thing the oncologist and the surgeon, who was the head surgeon, brilliant Dr. Alyssa Port, kept saying was, don't get fat. When you get out of chemo, don't get fat. Okay. How do I do that? That's a generalized statement, but fat holds and harbors toxins, and those toxins can turn into cancer. And to tell you the truth, I am not sure that the public really is ever told those connections.
Yeah, there is a high correlation between obesity and many cancers, including breast cancer, but many other cancers as well. So again, what I would encourage people to do is empower yourselves, educate yourselves. Again, I think that, since the food pyramid came out in the 70s, we've been going down this path. It has not worked. Increased obesity, increased diabetes, increased vascular disease, increased malignancies. So I think a good focus of people should be focus on their blood glucose physiology. And again, I think, using a continuous glucose monitor to do that. And I got to mention, Diane, that continuous glucose monitors are now going over the counter. So anybody now is going to be able to contact the two manufacturers, Dexcom or Abbott, and I think eventually just walk into your local drugstore and obtain a continuous glucose monitor. You put it on the back of your arm. It stays there for 2 weeks. You get 24/7 blood glucose readings. And I'm going to make a plug here. I believe in this so much that, I wrote this book on the continuous glucose monitor revolution. And it's really a Bible for people who can now go out and get a CGM over the counter and learn about their blood glucose physiology. Knowledge is power. And if you can educate yourself about this, realizing what we've done for 50 years hasn't worked, then you can go ahead and pursue the path that is best for you. Because unfortunately, I agree with what you say that medicine is not built now to help people with this disease prevention and disease reversal approach.
Much of it is, how can I say this? For you, the food pyramid in the 70s was consequential. For me, I'll never forget, it was about the mid 70s, and someone said, oh, I've got to take you for a hamburger today. I really didn't like hamburgers that much, but okay. Oh, you're going to love it. Where did I go for the first time? McDonald's. And I didn't get it at all. But now looking back, for me, I think, and I loved every old sitcom out of the 70s. And you look at everybody like Charlie's Angels, they're all so naturally thin. And it's because fast food was not on every street corner as a choice. And then I learned later on, a little bit later on, maybe 10 years later, because the French fries are so addictive that, do you know they actually soak? And I think this is true for every fast food chain. They soak their French fries in sugar syrup. And
Yeah.
they fry them because the sugar crystallizes as it's fried and comes out crispier, crunchier. And then I'm salivating as I'm just saying this. And then they put a lot of salt on top of it. So you get the sugar aspect and you get the salt aspect, which of course is going to raise your blood pressure as you get heavier. And they never admit it. And you only find out, I only found out honestly by accident because a friend of mine I went through college with wound up becoming part of management at McDonald's. And I asked him once, do you eat it? Thinking, wow, you really get a discount, huh? And he said, no, I would never eat it. And I thought, yeah, that doesn't sound too good. But the point is, the more educated you are, the more you can avoid the pitfalls. Some of that education we love to do on Too Young to Be Old podcast, because the amount of education you need to navigate life after 50 is just monumental. I loved, loved this podcast with you. And I think I'm not going to have my pasta for lunch. I think I'll just pass on that and try and do some kind of pure protein. Any last piece of advice you want to give on either insulin resistance? Oh, and by the way, one quick question. So if I have insulin resistance, does that mean I'm at the tippy top of tipping over into diabetes, or not necessarily?
So insulin resistance can start many years before you're even pre-diabetic. So it's a progression over a period of time. And insulin resistance, even pre-diabetes, is completely reversible if you take charge and follow some of the approaches that we've talked about. Now, once you're diabetic, I've actually had many patients I've been able to put in remission for their diabetes. I wouldn't say they're cured of their diabetes, but I've been able to get a number of diabetic patients off medications. But again, it comes down to educate yourself early about insulin resistance. Try a CGM because you can reverse your progression in that direction, and that can help you.
CGM, what is that?
Yeah, continuous glucose monitor. So again, you can reverse diseases. I have many patients that with weight loss, you can reverse sleep apnea, you can reverse fatty liver disease, you can reverse GERD. So again, consider the final words really are consider yourself to be empowered in terms of controlling your own health, and you can be successful in that regard. If you're well down this road, might it be more difficult? Yes. But again, I've had now thousands of patients that have been successful in reversing disease.
Yeah, I think the difficulty is two things. Number one, taking control of your own health. We are so used to, in our Western medicine system, deifying doctors. And what they say, you're a bad patient, which I've been told, if you don't just toe the line the way they want you to. And then when I went on Medicare, I really noticed that if it wasn't advantageous for them, like I'm fortunate enough to have the money to get certain things done without insurance, but my hospital system, I get a gel shot in my knee. They won't even take me for the gel shot unless they have a guarantee from insurance, Medicare, that it's going to be paid for. Yikes. So, yeah. So I think the most important thing you can know is that one word. No. Go out, get on the internet, do your research, take control of your health. And the minute I'm off this podcast, I'm throwing out my pasta meatballs. That's a big thing for me, okay? I love it. But gotta go, must go. Doctor, we're going to list the books you've written, your social media websites, because you are so valuable. And you're what, to me, my concept of medicine should be, which is preventative and proactive.
Yeah, it's a passion of mine, and quite honestly, it's very satisfying to see people redirect their lives from being unhealthy to healthy to reversing disease. So it's a passion of mine, and it grew out of many years in the emergency department. And I'm really fortunate, I feel, to be where I am right now and spreading the gospel about low carb, intermittent fasting, strength training, and the use of continuous glucose monitors.
I thank you so much, Dr. Paul Kolodzik, absolute genius at taking away that unbelievable spare tire midriff and so much more. Look at how vanity stricken I am. I just worried about my body shape, but so many of us, it really is about obesity, and it is about your all over health and how important it is to understand your body as you age. And we're all about 50 onwards here. Thank you, doctor. This was fabulous podcast.
It's been great joining you, Diane. Thank you very much.
Thank you so much for listening to Too Young to Be Old podcast. The episode may be over, but the fun doesn't have to stop here. Find us on Facebook, Instagram, TikTok, and YouTube at The Diane Gilman, or visit our website, thedianegilman.com. If you like the show, leave us a rating or a review and subscribe so you don't miss the next episode. And until then, don't forget, age is just a number. Together, we'll prove that we are all too young to be old.